Hi, everyone. Welcome back to our lecture discussion today. We are live right now for the NCLEX art review session. We are on day 32nd of the 90-day free NCLEX review series. Now, we are also inviting you to enroll in our comprehensive NCLEX review course at Stancoast NCLEX Coaching, where you can access a wealth of resources, over 3,000 NCLEX questions, and also 10 hours of animated video series for flexible study. And this is going to help you in building your confidence. Also, you can access our on-demand video library and practice exams. And we encourage you to visit at our website at www.stancoastnclexcoaching.com, and also check out the link below in the description box. And we also value your feedback, and we want to make sure that you can also share your thoughts and also questions in the comment section, and we'll be happy to help you. Now, today we will talk about the cardiac catheterization and also NCLEX questions related to that. And we'll go a little bit back further on some of the test questions that we went over yesterday in order to clarify some of the points. So let's get started right now. All right. So our concept today is on the cardiac catheterization, which is basically an invasive test, which is going to involve the insertion of a catheter into the heart and also the surrounding blood vessels. Let me just check real quick. All right. Now, this test also will obtain some information about the heart chambers, also the heart valves, and also the coronary circulation. And we do have the following indications why the cardiac catheterization is going to be done. And one of those is to help in the diagnosis of the coronary artery disease. All right. And so this is going to help evaluate the extent and the location of the coronary artery blockages, or let's say the narrowing of the coronary artery. Now, another reason is to help in the assessment of the angina in order to help determine the cause and also the severity of the angina symptoms that are not adequately controlled, maybe by the medications being prescribed. Now, this is also going to be used to evaluate MI or heart attack in order to assess the extent of the damage, in order to check the heart muscle, and also to identify the affected coronary artery. Now, guys, take note that this is also going to be useful in evaluating the valvular heart disease, and this is going to assess the severity of the valve dysfunction and also its impact on the cardiac function. Now, this is also going to be used to check for the cardiac function, and it will be helpful in assessing the overall function of the heart chambers, the heart valves, and also the coronary circulation. For those patients that may have heart failure or maybe having the cardiomyopathy. Now, let's move forward with the next indication here, which is to evaluate the patient before they're going to undergo a cardiac surgery. And this is going to be very crucial in order to assess the anatomy of the coronary artery before the invasive procedure is done, or let's say when they go before the coronary artery bypass grafting. Hello, everyone. Welcome back to the class. For those who just came in to join us, welcome back. All right. Now let's also talk about the need for the for us to get familiarized with the different approaches, or let's say the insertion site, when the cardiac catheterization is going to be done. All right. So I hope that you have a little bit of idea already, but if not, we're going to go through some of the basics here. So we will know exactly where we're going to be checking the pulses later on after the cardiac catheterization has been done. Now, we will talk about the aspects here. It's going to be about the insertion site and also the complications between the right-sided catheterization or could be the left-sided catheterization. And with that, the insertion site here for the right-sided catheterization is going to be accessed via the femoral vein, and this is also going to be advanced into the inferior vena cava. Okay, again, when the medical provider or the cardiologist decides on doing a cardiac catheterization to the right side, then the insertion side of the catheter will be in the femoral vein, and this will be advanced into the inferior vena cava or the basilic vein, and this is going to be threaded into the superior vena cava. And guys, this is going to be specified in the medical order or the provider's order where exactly the insertion site is. So we will know for sure where to do the clipping and also preparing the site before we're going to send the patient to the cath lab. All right, so please take note about the site where it's supposed to be inserted. Okay. However, if we're going to have a patient that's due for a left-sided catheterization, then this is going to be inserted into the femoral artery or the brachial artery, or could be the radial artery. Now let's go back just a real quick here regarding the right-sided heart failure. So the insertion will be again in the vein blood vessel. It's not going to be an artery if this is going to be the right-sided heart failure. So again, like I've said, it will be inserted into the femoral vein or could be the basilic vein. And it will be threaded into either the inferior vena cava if it's inserted through the femoral vein, or it could be into the superior vena cava if it's going to be inserted in the basilic vein. All right. Now, regarding the left-sided catheterization, the approach here or the insertion will be through an artery. Okay. Now, the patient around this time will have the insertion in the femoral artery, brachial artery, or the radial artery. Now let's zoom this in. Again, since we're talking about the left side of the heart, it will be advanced into the aorta, all right? And it will be threaded into the left side of the heart, okay? And this is going to view specifically the left chambers of the heart, the left atrium and also the left ventricle. And along with that, the cardiologist will be able to visualize the coronary arteries, the aortic root. And this is more invasive compared to the right-sided catheterization. And it can evaluate a whole lot more details regarding the coronary circulation. And again, this is going to the most common access. I'm talking about the radial, if it's going to be one of the sites to be, if the medical provider will decide on inserting the catheter to the radial artery, this is known to be the most common access site for the diagnostic catheterization examination. All right. Now, the size of the stent delivery and also the catheter, this is not going to be kind of like possible for all the patients, especially if we are just like thinking about the radial. This is not going to be possible in all patients, so that's just like an exception. However, though, talking about the different complications here, we have for the right-sided catheterization, one of those complications will be the venous thrombosis, and this is because of the placement of the catheter into the vein. Another is pulmonary embolism, and possibly through the dislodgement of the clots, or air embolism. Well, of course, with the entry of that catheter, it might allow some air to go inside the bloodstream through the venous circulation, and it will eventually lodge into the pulmonary arteries, arterioles, and there can be some infection that will probably happen right after the insertion, and also occurrence of arrhythmias. However, if we are talking about the left-sided catheterization, it can lead to arterial thrombosis, and this can potentially lead to ischemia, as we know that if there is going to a block into the arterial blood vessel, we know that it's responsible to supplying the blood, oxygen to the distal organs, the tissues. And so this can cause ischemia to that distal part, impairing the circulation and blood supply and oxygen as well. Now, it can also cause some pseudoaneurysm formation. Basically, it's going to cause weakness in the arterial wall, and this will bulge and eventually will probably rupture. We also have hematoma, which is a collection of the blood at the puncture site. And this will be one of your critical assessments that you need to be looking for. Okay, make sure that we are observing the insertion site for any of the hematoma. Okay, and same thing with the bleeding, because of the puncture involved. We're going to make sure that we're looking for any signs of drainage or any bleeding. Make sure that we are monitoring it from time to time to make sure that it's not going to be prolonged type of bleeding. Now, also with the puncture site, this can lead to some complication such as infection. It can also lead to hematoma. All right, let's move on here to the nursing actions that you should know about before we are going to send the patient to the cath lab. There's a whole lot of preparations that we need to do beforehand. And so one of those preparations basically is to make sure that we are checking the medical provider's order and make sure that we are obtaining the consent to make sure that it is signed and the patient understood, or maybe if there's a medical proxy who will be signing in lieu for the patient, then we'll make sure that it is obtained. All right. Now, we're also going to have to assess the patient for any allergies. And we're talking about allergies to seafood, iodine, radiopaque dyes, and in some cases, really, medical providers may push through the cardiac catheterization despite if the patient had some known allergies to iodine or seafood, but they're going to do something else. They're going to have to order antihistamines, or they're going to order that pre-medication in order to prevent any allergic reactions. But this is happening just rarely. Most of the time, the doctors will not do that. So yeah, just throwing it out there. In some cases, rare cases, the cardiac cath will probably push through, even though the patient is allergic to any of the substances that I've mentioned. However, they're gonna have to order pre-medication. And this will include the administration of antihistamines, such as the diphenhydramine, okay, or maybe they're going to order something else, maybe a steroid-based medication in order to prevent any potential anaphylactic reaction. All right. Now, another responsibility that we need to do is to make sure we keep our patient NPO. Now, please take note, guys, that the NPO will vary here. Most of the time, if we're going to place them NPO for solid foods, it will be at least 6 to 8 hours before the procedure, okay? And it will be 4 hours NPO for the liquids. So please take note about the different time frames. Now, for the patient's height and weight, this is something that we need to obtain accurately, get that recent or obtain the current weight and also the height of the patient, because some of the medications that will potentially be given will be based on the patient's weight. Now, we're also going to have to make sure that the patient is aware that there will be an administration of a local anesthetic agent, and also warn them about the potential weird sensations that they might feel during the procedure. So they might feel that warmth and sensation as soon as the contrast media is injected. Okay, so let them know that this is an expected finding, that they're going to feel some flush or warm sensation. Now, another thing that we need to incorporate here in the pre-procedure checklist is to do the skin prep. And again, this will be specified in the provider's order to where exactly do the skin prep. Maybe it's going to be the right groin or the left, or any of those sites that we had mentioned. And also, we're going to have to do the clipping instead of using the straight razor because we don't want to cause nicks that will become a ground for a bacterial growth and infection. So we don't want to cause any minute injury to the skin. So shaving using that electronic shaver or with the use of that clipper will be recommended. All right. And also the application of antiseptics, it will also vary from one care provider to the next. Some of the care providers will probably order a topical antiseptic solution wash before the patient is sent to the cath lab. And this will be repeated in the cath lab again. So it just kind of varies. It depends who will be doing the procedure. But this is something that you needed to anticipate because most of the time this will be required. Now, another thing is the insertion of the IV line. We want to make sure that the patient has good, fresh, patent IV access. This is going to be used for the administration of possibly an anesthetic agent or the conscious sedation medication. We want to make sure that the IV is patent. Also for the injection of the conscious media. And just in case if any anaphylactic reaction occurs, then make sure that we have that patent IV to treat the patient's severe allergic reaction. Now, we are also going to take note here, guys, especially for the administration of pre-procedure medication, maybe a sedative or benzo. This is something that we're going to expect. All right. Now, there's also possibly going to be a need for us to hold the metformin if in case the patient is identified using this kind of oral hypoglycemic agent with their type 2 diabetes. And if they do use this kind of medication, our medical provider needs to be notified, make sure that they're aware that this is one of the medications, and to let them know or to get a clarification from them. Do we need to hold the medication 24 hours before the cardiac cath or no holding? Okay, so make sure that you communicate with the medical provider regarding this. In some institutions, there is that policy that will automatically would put that standing order to hold the metformin, but again, it will vary. Our role here is to make sure that this is going to be identified, that we're going to deal with this, because as we know that the contrast agent is nephrotoxic, okay? And the metformin itself is also a nephrotoxic. So having to add the contrast media during the procedure will overwhelm the kidneys, all right? So we want to make sure that we have that baseline information as far as like the kidney function. Let me write it down here. Renal function test. I'm gonna take a look into the BUN and also that creatinine. So if you think that the creatinine level and also the BUN is quite elevated, make sure that the medical provider is notified about this, okay? And in some cases, even the patient does not have any issues with their kidney function, they might have to place the patient as an observation, let's say 24 hours prior to the procedure. They're going to have to order some kind of IV fluid infusion to allow hydration to the patient, make sure that everything is cleared before the cardiac cath is performed. Okay, so again, IV fluid infusion probably be one of those, but it's not going to be applicable on everyone. Now, we will also talk about the nursing actions that we're going to do after the procedure has been completed. Okay, let me just take a look who's in the room right now. Okay, hello everyone. All right, now we're talking about the post-procedure nursing actions, and one of those will be to frequently check and monitor the patient's vital signs. And this is going to be really frequent during the first hours, first 2, 3, 4 hours after the procedure has been completed. As you see there, it will be probably every 15 minutes, or it could be every 30 minutes, and it will somehow decrease in the frequency as soon as the patient is much more stable. But again, the protocols within the hospital will be followed. And again, the frequency of the vital signs measurement will be quite more frequent during the first few hours to make sure that we are capturing those abnormal changes. Could be low blood pressure, tachycardia. And also we're going to have to check the patient's cardiac rhythm as well. Make sure that they have that cardiac monitoring attached to them to make sure that we are seeing those possible arrhythmias. Now, with the post-procedure, we're also going to check the patient for any chest pain. We are going to have to ask them from time to time, because sometimes they probably would not tell you right away if they have that kind of chest pain. And so make sure that you are going to have to really ask the patient if they feel any kind of discomfort. Even a tinge of discomfort in their chest would be significant. And if in case this is going to be present, we will have to notify the medical provider right away. The same thing if we're going to also check the patient's pulses. We have to make sure that we have a baseline information after the cardiac cath has been done. We have to make sure these are checked. The distal pulses. So for example, if the approach was the right femoral vein, you will be checking into the distal pulses, which will be the posterior tibialis, or it could be the dorsalis pedis, and to make sure that we are capturing any alterations in the pulsation. Because if there is going to be clot formation, then possibly it can lead to decreased circulation to the area. Or let's say, for example, if the approach is through an arterial vessel, then it can possibly block the circulation. It might cause ischemia and infarct to the distal extremity. Now we're also going to have to observe for the color, and this is going to be done as frequent as we can. In some cases, it's every 15-30 minutes for 2 hours initially. We're also going to check for the warmth. We're going to have to check for the sensation of the distal extremities with this minimum every 30 minutes times 2 hours. Okay, again, it will vary. In some institutions, it might be a lot more frequent. Okay, now don't forget about the circulation, the sensation, and the motor function, and the temperature. So let me add those. Circulation, sensation. So you're going to have the patient describe if they can feel your hand touching their distal extremity. If there's any tingling sensation or numbness, those are important information that you need to assess, guys. And the other one is motor. Would they still be able to move their toes? Are they going to be able to wiggle those toes? And if there's a problem with the movement, if there's a change, then that is quite significant. You need to notify that to the medical provider. And another is the temperature. Okay. And of course, the color as well, right? Those are also crucial assessment findings that you need to obtain. All right, hang on a second. I need my monitor so I can see the questions, if there are any questions right now. All right, very good. Now, with those abnormal sensations, if there is going to be abnormal coloration of the skin, or let's say a diminished pulsation after the cardiac catheterization, then these are going to be reported. Make sure that the medical provider is aware about this. I'm talking about the medical provider who did the cardiac catheterization. Again, we want to make sure that we are notifying the medical provider for any numbness, tingling sensation, if there is any cyanosis of the extremity, and loss of the peripheral pulse. Okay, because these are indications that there could be a clot formation. Not a good sign. Clot formation. Again, these are and causing obstruction to that blood vessel. Obstruction. All right. Now, another thing that you need to keep an eye on here, guys, is going to be the application of a sandbag, or let's say the compression device close to the insertion site. And this is going to apply the pressure and to prevent the possible bleeding, okay? And we're going to have to monitor the insertion site for any signs of bleeding. We want to make sure that as soon as we see any tinge of blood, we're going to have to monitor on it, and we will manually apply the pressure, and we'll have to notify the medical provider if the bleeding occurs. Now, aside from that, we will be checking into the hematoma. Okay, hematoma is basically the leak or the bleeding underneath the skin. So hematoma is also going to be reported. We're going to notify the medical provider right away. Now, here's the thing, guys. If the scenario in the NCLEX would probably state that there is a vascular closure device being used, then that's good, right? If it's indicated there. So what is this? This is going to allow less restriction post the cardiac catheterization, because this will kind of give what do you call this? The patient will be allowed to be out of bed in about 1 to 2 hours after the cardiac catheterization. So this is the advantage of having that vascular closure device. All right. And the bed rest and also the compression into the site will not be as prolonged compared to the patient without the vascular closure device. Again, this is only if the NCLEX states that there is vascular closure, but I don't think that they're going to do that. So here's another thing. Probably this will be more common to come out in the exam if no vascular closure device is used. Again, so we will make sure that the patient's extremity, where the insertion site was done, it should be extended for 4 to 6 hours. And this is to make sure that it will not cause dislodgement of that clot that was supposed to be there in order to prevent the bleeding. And also make sure that we are going to place the patient on bed rest for 6 to 12 hours. All right. And the head of bed should not be elevated more than 15 degrees. Anything above that is contraindicated. And we want to make sure if it's involving maybe an arm or an antecubital vessel or the basilic vein, then we want to make sure that we are immobilizing the arm. If the insertion site is the arm, okay? Only if. Again, emphasizing right now, this is only something that you need to be aware of. Let's say, for example, if there is a specific wording in the question that maybe the patient has a vascular closure device. So the benefit here is that the patient will have less restriction. They can get out of bed 1 to 2 hours after the procedure, and there will be much more limited time in the application of the compression or also the sandbag or the bed rest. However, if the NCLEX did not mention anything about the vascular closure device, then we will go for these set of interventions, okay? So make sure we're going to have to keep the extremities straight for 4 to 6 hours. We'll have to make sure that they will be in bed rest for 4 to 6 hours for the extension of the extremity, bed rest for 6 to 12 hours, and then we are going to avoid the elevation of the head of bed greater than 15 degrees angle. Now, another thing that you need to keep in mind with the post-cardiac cath nursing care is to encourage the fluid intake. And the reason for that, it's because we want to promote the excretion of the contrast media. We don't want the contrast media to stay longer in the bloodstream. We want to make sure that this is going to be eliminated via the kidneys. And with the increased intake of fluid, this will facilitate that. But in some cases, if the patient will not be able to tolerate increased fluid intake, then probably we're going to have to obtain an order to administer IV fluid, normal saline solution, in lieu of the oral fluids if they cannot tolerate. Okay, so that's the caveat. Another thing is we're going to have to check them, monitor them for any nausea, vomiting, any rash, because these are possible signs that they are hypersensitive to the dye. Okay. Dye hypersensitivity. Oops. And of course, if the patient will end up with nausea and vomiting, then if we don't have any orders for antiemetic medication, go ahead and notify the medical provider. So we will be able to let them know, hey, is this going to be a hypersensitive reaction? And so the medical provider will be able to order medications to counteract the effects. All right. Now, we will be tackling now the different test questions. We'll see if we had retained any of those information. So we have our first question. Question number 1, what is the most critical assessment a nurse must perform when preparing a patient for cardiac catheterization? Is it A, patient's body weight and height, B, allergies to iodine or shellfish, C, apical heart rate, D, heart rhythm? Okay. Question 1. What is the most critical assessment a nurse must perform when preparing a patient? Must perform when preparing a patient for cardiac catheterization. Is it A, patient's body weight and height, B, allergies to iodine or shellfish, C, apical heart rate, D, heart rhythm? I'm seeing B from Mariama. All right, very good. Nigel answered B. Okay, so that is the correct answer. As I have said in the pre-procedure actions, we want to make sure that we have assessed this. Allergies to iodine or shellfish. Because the procedure is going to involve the injection of a contrast dye, and it will contain the iodine. And let me just write down here. B. All right. If the patient is allergic to those, and probably the patient was not screened properly, the information was not relayed, then this can lead to an anaphylactic reaction. That would not be great. Now let's go to letter A. What about letter A? Why is it wrong? Well, the body weight and height is going to be important as well in the pre-procedure assessment, but they do not take as high a priority compared to the allergy checking. Okay. Now, what about letter C, apical rate? This is also going to be important, but it doesn't take a higher priority compared to the B, and same thing with letter D. The cardiac rhythm is also important, but this will be secondary to the letter B. We want to make sure that we are screening the patient for the allergies, seafoods, and such. Okay, make sure that we have that information. Very good. Moving on. Question number 2. After a cardiac cath through the femoral artery, which assessment findings should be reported to the physician immediately? Is it A, Apical pulse rate of 98 beats per minute. B, small amount of red drainage on the dressing. C, absence of dorsalis pedis pulse. D, blood pressure reading of 104/72 mmHg. All right, here you go. The question is, after a cardiac cath through the femoral artery, which assessment finding should be reported to that physician immediately? Is it A, apical pulse rate of 98 beats per minute, B, small amount of red drainage on the dressing, C, absence of dorsalis pedis pulse, and D, blood pressure reading of 104/72 mmHg? All right, I'm seeing letter C's. Very good. All right, that is the correct answer. Letter C, absence of dorsalis pedis is gonna indicate that there is what? Occlusion in the blood vessel. It indicates occlusion in the blood vessel. And also causing compromise in the blood flow. We don't want this to go on further. We don't want to allow this to, we want to make sure that we are intervening this right away if in case there is absence of the pulsation, okay? Could be that blood clot lodging into that blood vessel. And why not letter A? Apical pulse rate of 98 beats per minute. Well, that is normal. Nothing to worry about 98 beats. I'm just going to put here W and L, within normal limits. Okay? In an adult. What about letter C? Oh, letter B. Small amount of red drainage on the dressing. Would that cause you to notify the medical provider right away? Well, letter B is going to be expected. This is going to be an expected finding. But it doesn't mean that once it is expected that you'll just let it go. You definitely need to make sure that you are to monitor the shadow. Okay, we want to make sure that you are monitoring that site, mark that site, and to see if there will be crossing over, if the drainage will grow bigger. So you will know for sure that there is an active bleed going on. Okay, we don't want that. So make sure that you're going to closely monitor for that small amount of red drainage. Again, you're going to have to mark that area, have that boundary monitored. Okay, now letter D, blood pressure reading of 104/72. That's within the normal range. Nothing to worry about. So again, our strategy here is to look for the serious complication. And our complication possibly here is circulation compromise. This is what we are looking for. Look for the circulation compromise, which is basically the absence of the dorsalis pedis pulse. Okay, we want to make sure that we notify the medical provider right away after we have assessed this. Letter C. Right? Now, moving on to the next question. After a cardiac cath, a patient has a large pool of blood under their buttocks. What should the nurse do first? Is it A, call for assistance, B, obtain a set of vital signs, C, ask the patient to lift their buttocks, D, put on a pair of clean gloves and assess the groin site? Again, question number 3, After a cardiac cath, a patient has a large pool of blood under their buttocks. What should the nurse do first? A, call for assistance. B, obtain a set of vital signs. C, ask the patient to lift their buttocks. And D, put on a pair of clean gloves and assess the groin site. All right. Large pool of blood under the buttocks. What you should do first. Okay. Are you going to call for assistance? Let's take a look. Okay. We have seen D's. We're seeing B. Okay. A large pool of blood. We know already that in cardiac catheterization, one of the biggest complications here is the bleeding. We already know that. Okay. And so if you are going to see this, you want to make sure that you're going to intervene right away. Again, we are going to have to actually make sure that we have not really intervene like an action, but we have to investigate right away what could be going on into the insertion site. All right. So let's take a look on letter D. Put on a pair of clean gloves and assess the groin site. Well, that is the correct answer. Why? Letter D, we should have to follow the universal precautions. We're going to make sure that we are wearing the gloves, pair of gloves, before we're going to touch the patient, and to make sure that we are assessing the groin to determine the source, and also to check for the severity of the bleeding. So the reason that we are doing this is to observe universal precautions. Always do that, guys. Bodily fluids, blood, yeah, always do that. Observe universal precaution. And the reason for this step, letter D, is we are going to assess or determine the source of bleeding. I'm talking about the insertion site. And also the severity of the bleeding. So these are the things that the reasons why we are doing or selecting letter D. Severity of bleeding. All right. So this will be our answer. Why not letter A? Call for assistance. So once you see this one right away, once you do this step, you want to make sure that you immediately apply pressure. Whoops. Immediately apply pressure to the insertion site. Do not delay when you are applying the pressure. As soon as you do this, once you had figured out, hey, it's really coming out from that insertion site, apply the pressure right away. It will be extended pressure to the site, not just 5 minutes. It will be extended more than 5 minutes. Could be 10, 30 minutes. We don't know what really is causing the massive bleeding, but we want to make sure that the pressure is applied directly. Okay. Now, the control of bleeding is very important in this scenario. Okay. Now, for letter A, why is letter A a wrong option? It's because calling for assistance will delay the bleeding control. Yeah, you can call for assistance, you can yell out, but it doesn't take priority compared to letter D. It can delay the bleeding control. All right. Now, we also have letter B. Okay, let us mark this one as letter call for assistance is wrong. Obtain a set of vital signs. Okay. The vital signs are also important, guys, but it doesn't take precedence to the control of bleeding, okay? And so this is letter D, which is basically an assessment. But once you do that, make sure that you apply the pressure right away. So that would be that kind of like sequence in the steps right there. Now, what about letter C? Ask the patient to lift their buttocks. That is wrong. And the reason for that is because once you do that, once you instruct the patient to lift their buttocks, it can potentially disrupt the clotted area where the insertion site is, and it will further cause bleeding from the site. Okay, again, the reason for not doing letter C, it's because it can potentially disturb the clot that has stabilized the site in order to prevent from bleeding. And yeah, it can complicate some more. It can lead to further hemorrhage. So we don't want to have this patient lifting their buttocks. We want to make sure that they are on bed rest. Okay. So our strategy here is to make sure you do a quick assessment. Once you have seen the large pool of blood, quick assessment of the insertion site, and right away you apply the pressure to control the bleeding. Okay, so that would be our strategy in answering this question. Do your quick assessment, apply pressure right away once you see active bleeding in this patient. All right, now let's move on to the next question, guys. Number 4. 3 hours after cardiac catheterization through the femoral artery, a patient complains of numbness and pain in the right foot. What should the nurse do first? Question number 4. 3 hours after a cardiac catheterization through the femoral artery, a patient complains of numbness and pain in the right foot. What should the nurse do first? Is it A, contact the medical provider, B, check the pedal pulses, C, measure the blood pressure, D, acknowledge it is a normal response? Okay? Take your pick. I'm seeing letter B, check the pedal pulse. Patient complains of numbness and pain in the right foot. Okay. All right. The correct answer here, guys, is letter B. Nothing else. Check the pedal pulses. All right. The insertion site is through the femoral artery, which is basically in the groin area, right? And after the patient had the cardiac catheterization, if in case, or if they complain of the numbness and pain in the right foot, we want to make sure that we are checking for the patency of the circulation, or let's say there should be what do you call this, presence, or let's just put it this way, pulsation. This is very important because if there is going to be some numbness and pain, these are signs that there could be decrease in blood flow. So we want to make sure that we are checking for any of those signs, because that could really compromise the pulse into the distal extremity, let's say the dorsalis pedis or the posterior tibialis pulse. So we want to make sure that we are doing that quick assessment. Then also the letter A, contact the medical provider. Before you do the call, make sure that you have obtained the necessary information. Make sure that you have done do the assessment first before calling. Make sure that you have enough information so that you'll be able to report to the medical provider. They might ask you, hey, what is going on really? Can you tell me more about it? And so if you don't have enough information or assessment findings, it can just delay the treatment, right? So you want to make sure that you should do the assessment before you make that call, okay? Numbness and pain could possibly lead to a much worse complication. So we want to make sure we will be assessing it. And once we do that, we will have to contact the medical provider. So our answer here is letter B. Make sure you do the pulse check firsthand, okay? Now, what about letter C? Measure the blood pressure. Yeah, it is also important, guys, but it does not address the localized issue and the perfusion. So blood pressure checking, it does not address the localized numbness and decreased perfusion. It doesn't. Okay. All right. What about letter D? Acknowledge it is a normal response. Is it really? No, it isn't. Numbness and pain are not normal responses, and we would really need to investigate it. Okay. Numbness and pain. These are signs of circulation or perfusion compromise. Okay. This is wrong. This is wrong, and this is wrong. All right. So our strategy here is to make sure that we are prioritizing the action that can directly assess and address the patient's immediate symptoms. That's the reason that we are checking on the pedal pulses. All right. Circulation again, guys. Don't miss out on that. Circulation issue. Yeah, it's kind of like confusing, right? Because I'm doing all these similar test questions. But again, I'm just wanting to make sure that this is going to be imprinted in your subconscious. Make sure that you're able to really address the common complications. What about number 5? Before we go do that, I am again promoting the course that we are offering at www.stancoastandflexcoaching.com. Make sure that you enroll because we do have a lot of perks there. We have a lot of resources, over about 3,000 NCLEX questions and 10 hours of animated videos, and also lecture discussions that you can access 24/7 for about 6 months. So again, we are requesting you to check out on the comments or the description box below for more details. All right, make sure you go do that. Now let's proceed with our next question. Where were we at? Oh, not that one. All right, so we are going to be in question number 5. We did it yesterday. Wonderful. All right. Welcome, Deep. All right. Now, number 5, after a cardiac cath via the femoral artery, what is the most important nursing action? A, provide a bed cradle. B, check for a pulse deficit. C, elevate the head of the bed. D, assess the groin for bleeding. A, provide a bed cradle. B, check for a pulse deficit. C, elevate the head of the bed. And D, assess the groin for bleeding. The question is, after a cardiac cath via the femoral artery, what is the most important nursing action? It's a multiple choice, guys. What is your answer? Are you going to provide the bed cradle? Thank you. Yeah, we still have to talk a little bit about the last question yesterday because I've seen that comment. But we'll do this, that question after we finish all these items. Letter D, assess the groin for bleeding. Femoral artery, okay? Let's go through the selections first. All right, let's have the selection first. Letter A, provide a bed cradle. What is this? Have you seen a bed cradle in the acute care setting when you were back in your clinicals? Have you seen those bed cradle? So I just want to make sure that you understand what this is. So what is that bed cradle? Basically, the bed cradle is like just kind of a material that has that kind of like an I think it's more of like a metal product that kind of is going to be placed right at the foot part of the bed in order to prevent any of those heavy weight objects or any of like heavy blankets, comforter, any sheets from applying or to the reason for that is to basically to lift off the weights that could potentially cause pressure into the lower extremities of the patient. So basically the blankets will be kind of hang above the bed cradle, and this is something that we often place in the foot part of the patient's bed when they have like leg cellulitis or any kind of wound. Then this is what we're going to apply. That's the bed cradle, right? So are we supposed to prioritize placing the bed cradle into this patient's bed? Well, this is not going to be required for this patient. So we are going to eliminate letter A. What about letter B? Check for a pulse deficit. What is that? Basically, what we're going to do here is to compare the pulse of the distal extremity, comparing it to the other pulse in the other site. So basically what we're capturing here is to observe, compare the rate of the pulsation from the affected extremity versus the non-affected extremity, okay? So this is also going to be an important nursing intervention, but it doesn't take higher priority compared to the answer that I'll be selecting right now. So we will eliminate letter B. Now, what about elevate the head of the bed? It didn't specify about how high the elevation is. But in general, elevation of the head of the bed is going to be contraindicated, especially that it's not specified. Okay, let me just write it here. Head of bed elevation that is not specified. Let me rewrite that fast. Whoops. Not specified. Remember what I said earlier, that we are not going to elevate the head of the bed post-procedure greater than 15 degrees angle, but in this case, it did not specify. So if it's going to be like that, then assume that this is probably higher than 15. So we're going to have to contraindicate letter C. All right. It should be elevated only less than 15, but in this option, it was not specified. So I want you to be really cautious when answering. Make sure that you have that information. But if not, then consider that as elevation. Okay? All right. Same thing with a compression device in a patient. And so if it's not specified, you're going to have to just consider the like the basic nursing care. Extended bed to rest, extension of the leg for more hours. Yeah. Now, what about letter D? Assess the groin for bleeding. Basically, that is the correct answer. Let me just write it here. It is letter D. The assessment of the bleeding in the groin area is going to be very critical here. This is the most known complication. It's the same with the hematoma, okay? So we are definitely gonna prioritize this action. Assess the groin for bleeding, okay? because once it's gonna have that bleeding, this will also lead to extensive blood loss. Okay, we definitely need to intervene after you do this. Quickly apply manual pressure. All right. That would be our priority. Again, this is quite similar with the other choices that we have undergone. But again, I'm just testing you here if this will really stick into your brain. Okay, moving on to the next question. Number 6, for a diabetic patient on metformin scheduled for a cardiac cath, what should the nurse ensure is ordered by the physician? Again, number 6, for a diabetic patient on metformin scheduled for a cardiac cath, what should the nurse ensure is ordered by the physician? Is it A, limit protein intake before the procedure, B, withhold metformin before the procedure, C, take metformin with a small amount of water, D, administer metformin before breakfast? All right, your choices, please. Limit protein intake before the procedure, B, withhold metformin before the procedure, C, take metformin with a small amount of water, D, administer metformin before breakfast. Yes, very good. Our correct answer here, guys, is letter B. Remember about the holding of the medication? About how many hours? About 24, right? Before the procedure, okay? That is a correct answer. Withhold. It should be done so because the medication itself, let me just write it here. The met, which is an oral anti-diabetic medication. Wait a second here. The medication metformin is an oral hypoglycemic medication for type 2 diabetes. For type 2 diabetes. All right. For those who don't know yet or not quite familiar with metformin, this is an oral hypoglycemic agent to control the blood sugar in type 2 diabetic patients. Okay. Now, the reason that we are doing letter B is going to prevent the risk of lactic acidosis. Let me just write it here. Withholding can prevent lactic acidosis. That's the main reason about that, which is a serious complication when the patient undergoes cardiac catheterization. We don't want this to occur in our patient, okay? We are going to hold the drug in order to prevent lactic acidosis. But guys, please take note that holding or withholding the medication is not an independent nursing action. Withholding medication, not an independent nursing action. You have to notify the medical provider about this, okay? You have to, because it has to be ordered as such that you are supposed to be holding the medication, okay? Do not just automatically do it without the notification, and make sure that when the doctor states, hey, we're gonna hold this medication, write that as a verbal order. If you are calling the medical provider over the phone, then make sure that you obtain that as a verbal order. Do not just, I'm just going to do it. I already know that the metformin can do the lactic acidosis, or it can complicate into lactic acidosis. No, that's not supposed to happen. You should notify the medical provider as soon as you know that the patient takes the metformin and obtain an order to make sure that it is official, okay? And the metformin, again, will be resumed 48 hours after the procedure has been done, after cardiac cath. You have to notify the medical provider. This is not something that you can just automatically do, that you can resume the medication. Guys, please don't get confused. Always, when you are involved in withholding and continuation of a medication, you just can't automatically resume the administration. You need to notify the medical provider, and the pharmacist should know about this. Hey, our patient has already completed the cardiac catheterization, and the doctor has already been notified. He gave the order to resume the medication. Okay, so that would be the exact steps. Okay, I know that you know about that 48 hours resumption, but again, just want to clarify with you guys the proper way of resuming and withholding the medications. Okay, so it should be official. Make sure that you communicate with the medical provider, and then write an official what do you call this, verbal order if they were contacted via the phone, or if not, if they knew about it, they are in-house when you notify them. So make sure that there is that active order that they're going to resume the metformin. All right, now what about letter A, limit protein intake? This is not going to be relevant in the cardiac cath procedure, and so we are going to eliminate letter A. What about letter C? Take metformin with a small amount of water. No, we're not going to do that, because again, we know that the metformin can lead to the development of lactic acidosis when they're going to undergo the cardiac catheterization, right? Of course, with the contrast media. Now, letter D, administer metformin before breakfast. Well, yeah, that's also wrong. It's not going to mitigate the issue. It will lead to lactic acidosis when they get the cardiac cath. So our answer here is withhold the metformin before the procedure. And just to clarify, guys, when you do this withholding, I'm just adding more information. Notify the medical provider and make it official. All right. Okay, moving on to the next question. Number 7. Which task should the nurse perform before a cardiac cath is performed on a patient? Which task should the nurse perform before a cardiac catheterization is performed on a patient? A, administer all prescribed oral meds. B, check for iodine sensitivity. C, verify written consent. D, withhold food and fluids. E, insert a urinary catheter. All right. What is your answer here, guys? Roberta answered letter C. Verify written consent. This is, oh, I forgot. Sorry. Let me add it here. Select all that apply. Okay, let me wait for your answers. Yeah, that's SATA. I forgot to put it. Select. Oh boy. Select all that apply. Okay, let me wait for another set of seconds here. Again, the question states, which task should the nurse perform before a cardiac cath is must perform before a cardiac catheterization is performed on the patient? Select all that apply. So for those who just answered earlier, make sure that you reread what I wrote there. It's a SATA question. All right, it's a select all that apply. So the options that are correct here will be letters B, C, and D. So let's go through the selections here. Letter A, administer all prescribed oral medications. Are we supposed to do that? Well, remember about the NPO, right? We are not supposed to administer oral or solids at least 6 to 8 hours before the test. And for the liquids, you're not supposed to be giving them any fluids at least 4 hours before the procedure. That's why we are eliminating letter A. Remember about the NPO, about 6 to 8 hours for solids, and then about 4 to 6 hours for the liquids. Okay? Remember about the NPO. Now, what about letter B? Check for iodine sensitivity. Remember about what we just talked earlier about iodine? This is very crucial. And this is very crucial, guys. We are going to select this. Check for iodine sensitivity. Prevent severe allergic reaction. So that's one of the correct options. Now, what about letter C? Verify written consent. Well, yeah, this is also important. This is a required document. Whoops. Any invasive procedure, make sure that you obtain the written consent and verification. This is crucial. Now, what about letter D? Withhold food and fluids. Yeah, that's what I already said about letter A. So that is also a correct answer. Now, letter E, insert a urinary catheter. This is not required. So the correct answers here, guys, are B, letter C, and letter D. Okay. All right. Very good. Now, our test taking strategy here, guys, make sure that you are focusing on those interventions that will ensure the patient safety and also compliance to the protocol. Okay, so these are promoting safety and compliance to protocols. Okay, so that is the reason why we are selecting those three options. Again, verify the consent, allergies, and fasting requirement. Okay, do not forget those things. Now, moving into the next question, guys, we are on question number 8. We're halfway. What is the most important initial assessment for a nurse to perform after a cardiac catheterization? Again, what is the most important initial assessment for a nurse to perform after a cardiac catheterization? Is it A, monitor lab values, B, observe neurological function every 15 minutes, C, check the puncture site for swelling and bleeding, and D, monitor skin warmth and turgor? Again, what is the most important initial assessment for a nurse to perform after a cardiac cath? Initial assessment. Is it A, monitor lab values, B, observe for neurological function every 15 minutes, C, check the puncture site for swelling and bleeding, D, monitor skin warmth and turgor? Very good. We are seeing C's. The correct answer is letter C. All the time. Never miss check the puncture site for swelling and bleeding. Okay, again, early detection guys, when you are the nurse taking care of this patient, as soon as you receive the patient after the cardiac cath procedure, always make sure that you are checking the site. Assess the puncture site. And the frequency for this one will be very frequent during the first few hours after the procedure. It will be as close as 10 to 15 every 10 to 15 minutes. And you want to make sure that you are monitoring for any shadowing. Make sure that you are going to monitor for any prolongation or extension of the bleed. Now, if you had answered letter A, which is monitor lab values, which is going to be also important, guys, but they do not, this is not going to be the immediate intervention or action to do, okay? We are eliminating letter A. Monitoring of lab values is also important. However, they are not the most immediate concern after the procedure. What about letter C? Observe neurological function every 15 minutes. Do you think so? They're going to be assessed as well, but not as immediate as ensuring about the no active bleeding, okay? We're also going to eliminate that. And letter D, monitor skin warmth and turgor. This is also important, but this is going to be less critical. Okay. Bleeding takes priority. All righty. Let's move on to the next question here, guys. After cardiac cath, the left femoral dressing has moderately bloody drainage and the patient has severe pain. What should the nurse do first? After cardiac cath, the left femoral dressing has moderate bloody drainage and the patient has severe pain. What should the nurse do first? Is it A, assess the airway, B, administer oxygen, C, apply pressure to the site, D, check the pulse in the left extremity? Is it A, assessing the airway, B, administer O2, C, apply pressure to the site, D, check the pulse in the left extremity? What do you think? Am I seeing your answers already? Yeah? Okay, the correct answer here is application or applying pressure. Very good. Go pal for putting in your number there, number 9C. That's good. Thank you. The answer for item number 9 is letter C. We are back to applying pressure again. It's getting old, but I'm just testing you guys. Testing. Applying the pressure to the site is the immediate action to control the active bleeding. It already stated in the scenario, left femoral dressing has moderate bloody drainage. That is the clue here. Okay. And the patient is already having severe pain. I just don't like that. All right. So make sure you control the bleeding to further prevent the blood loss. Further blood loss. Make sure you do that. Why not letter A, assess the airway? Do we have any information about the patient's airway issue? No, we don't. Okay. So assessing the airway at the moment would take the secondary priority at this moment. We are marking this as wrong. Secondary priority. What about letter B? Administer oxygen. We are going to indicate that as wrong as well in this situation, because we don't have any information regarding the issue with their perfusion. We don't. What about letter D? Check the pulse in the left extremity. What do you think about the D? Check the pulse in the distal or in the left extremity. Kind of sounds good, right? But we definitely need to make sure we have applied the pressure first, okay? There's already a assessment finding that the patient has moderate bleeding. That would be the priority right that minute. You have to intervene right now. Because of the bleeding. Okay. You're not going to need some more assessment before you're going to have to apply the pressure. You don't. Make sure that you immediately apply the pressure to control the blood loss. Okay. Now let's move on to the next question. Number 10, which nursing intervention should be implemented by the nurse when a patient returns to the nursing unit after cardiac catheterization? Select all that apply. Question number 10, which nursing intervention should be implemented by the nurse when a patient returns to the nursing unit after the cardiac catheterization? Select all that apply. Is it A, monitor vital signs every 15 minutes, B, assess all peripheral pulses frequently, C, keep the patient on bed rest for 4 to 6 hours, and D, examine the insertion site, and E, perform range of motion exercises? Again, the question states, which nursing intervention should be implemented by the nurse when a patient returns to the nursing unit after cardiac catheterization? Select all that apply. A, monitor vital signs every 15 minutes. B, assess all peripheral pulse frequently. C, keep the patient on bed rest for 4 to 6 hours. And D, examine the insertion site. E, perform range of motion exercises. What are your answers here, guys? I'm seeing ABD. I'm seeing BCD, ACD. All right. Good for those who have really good eyes. ABCD. Okay, let's take a look into the options right now. What about letter A? Monitor the vital signs every 15 minutes. Yeah, that is one of the answers. So let me just write down here the answers: A, C, and D. Why letter A? Because when you are frequently monitoring the vital signs every 15 minutes, it can detect early signs of complication. Okay. So respirations, heart rate, those are the early signs that can signify blood loss. Early. So these are significant abnormal assessment findings. Elevation of the heart rate and respirations will signify that there is blood loss early. Okay. Now, what about letter B? assess all peripheral pulses frequently. Okay, this is wrong. Why? The reason that this is incorrect, it's because it's saying all. This is wrong. Can't even spell. We are not going to assess all pulse sites. The answer is no. You're only going to check the distal pulse site. Okay? The distal pulse site from where the insertion has occurred. Okay? So for example, right femoral vein. So you are going to assess the distal pulses from there. So right dorsalis pedis, right posterior tibialis pulse. Okay? So we are not going to measure every part, every radial pulse in the body. No, we are not going to do that. So this is making it incorrect. All made it incorrect. So we are only going to check or assess the distal pulse sites. Okay. Now, what about letter C? Keep the patient on bed rest for 4 to 6 hours. How is that? Is that one of the requirements that we have, since we did not have a specification here that there is a compression device? Yeah, that is correct. Keep the patient on bed rest for 4 to 6 hours. That is one of those. Now, what about letter D? Examine the insertion site. Hang on a second here. Yeah, so letter D, examine the insertion site. We are going to do that in order to identify any signs of bleeding. Okay, so that's why we're going to do that frequently, every 15 minutes initially, and then we're going to have to have a much wider intervals between after good amounts of hours. Okay. All right. What about letter E? Perform range of motion exercises. That is incorrect. We are not going to let the patient do the range of motion exercises yet, because this can what? Aggravate the bleeding. Okay. This will disturb the insertion site. This can increases risk of bleeding. Let me just erase that. Okay, so again, our answers are letter A. We're going to have to implement letter C as well. And then we're going to have to select letter D. A, C, and D. All right. So you guys have to eliminate letter B. Not all pulse sites. Okay, we're not. Just the pulse sites, distal pulse sites. All righty. Okay. Again, we'll just have a short break. Again, I'm promoting about our NCLEX review course at our website. Kindly visit www.stancoastnclexcoaching.com. Enjoy this for the entire 6 months with your subscription. Make sure that you'll be able to access all our lectures. And we do have some more 3000 NCLEX style questions, animated videos that you can access And we have a lot of perks as well as far as study guides. You'll be able to do this for 6 months again, 24/7. All right, so kindly check on the description box below for more details. All right, let's move forward with question number 11. How should the nurse respond to a patient who feels that cardiac rehab is unnecessary after a significant heart attack? Number 11. How should the nurse respond to a patient who feels that cardiac rehab is unnecessary after a significant heart attack? Is it A, rehabilitation isn't a cure but can help you return to many of your usual activities? B, we will teach you to gradually change your lifestyle to manage your heart condition? C, you might be right, but we can help you increase your activities gradually? And D, do you think you need to make some changes in your life now? What is your answer here? This is a multiple choice item. Okay. The correct answer for this question is letter A. And the reason for that, it's because the statement made by the nurse here saying rehab isn't a cure, but can help you return to many of your usual activities. It's asking about, because the patient feels that the cardiac rehab is unnecessary. Well, letter A simply being described here, it is more realistic and positive, okay? It is actually emphasizing that rehab is not a cure, but eventually it will also improve the patient's quality of life by allowing them to at least restore many of their former activities, okay? So letter A is much more realistic. Okay. Rehab is not a cure, but it's actually giving them a means to help improve the quality of life, okay? And this will also help restore with many of their former activities. So that is the rationale. However, if you are selecting letter B, it's incorrect. The reason, because it's somewhat kind of like very instructional, kind of like very somewhat rigid, and this is going to kind of it might be sensed by the patient as less empathetic at this point, okay? So you have to make sure that you're gonna have make sure that you tell the patient first the reality about the rehab. That's the first one. Tell them that it's not curing the patient's condition, but it will at least restore some of those functions that they might be able to regain while doing the rehab, right? Because B, again, it is more instructional, less empathetic. Yeah, dismissive. And letter C, you might be right, but we can help you increase your activities gradually. So that also is negative. So you're actually agreeing to the patient without giving them really a better idea of what rehab can do for them. So it's basically negative and does not offer encouragement. Letter D. Do you think you need to make some changes in your life right now? So this is more of like you are basically not answering, not addressing the patient's concern. All right. So eliminating D right now, guys. So our correct answer here is letter A. Isn't a cure, but can help you return to many of your usual activities. That's the most realistic explanation. Okay. Now let's move forward with the next test question, number 12. What instructions should the nurse include in the pre-procedure teaching before a cardiac procedure or cardiac cath procedure? Is it A, remain completely still during the procedure? B, receive monitored anesthesia care during the procedure? C, expect a warm sensation when the dye is injected? D, have arterial pressure monitoring for 24 hours rather, post-test. Let me reread. What instructions should the nurse include in the pre-procedure teaching before a cardiac catheterization procedure? A, remain completely still during the procedure. B, receive monitored anesthesia care during the procedure. C, expect a warm sensation when the dye is injected. D, have arterial pressure monitoring for 24 hours post-test. Roberta answered letter C. Okay. The correct answer here is letter C. Okay, let me explain. When you answered letter A, remain completely still during the procedure, that is incorrect. Why? Because the patient should not be doing this. The word itself, completely still. Okay, that is not quite true, because the patient may be asked So let me write that down. The patient may be asked by the provider to take deep breaths or holding their breaths. And that is already considered as a movement, okay? So remaining completely still is not 100% correct, okay? Because again, during the procedure, the medical provider or the cardiologist might ask them to take deep breaths, or they might ask them to hold their breaths. So letter A is incorrect. I know, they should at least minimize movement. So anything like that, turning in bed, of course, that's not going to be, that's contraindicated. But like I've said, aside from just bodily movement, the breathing is already considered as the deep breathing, holding the breath is already one of those. So A is going to be incorrect. What about letter B? Receive monitored anesthesia during the procedure. What is that? Monitored anesthesia. What is monitored anesthesia? Let me write it down here. MAC. Monitored anesthesia care. What is this? This actually going to involve sedation and will be required in procedures needing high level of anesthesia. And the cardiac catheterization does not really require this. So that's why this is incorrect. Okay? Because in cardiac cath, this will require conscious sedation. Conscious sedation. So MAC is not going to be required for this procedure. So that is incorrect. Okay. What about letter C? Expect a warm sensation when the dye is injected. Yeah, that's what we talked about earlier as one of the pre-procedure teachings. Make sure that the patient is aware about this so they don't get shocked or surprised about the warmth sensation. Yeah, this is kind of like, ooh, what did I just feel here? I feel kind of like flushing right now. I feel the heat. So make sure that they know what to expect in order to allay the anxiety, okay? So this is going to be the correct answer. Expect a warm sensation. Now, what about letter D? Have arterial pressure monitoring for 24 hours post the procedure or after the procedure. Well, this definitely is going to require only a few hours post-procedure. So 24 hours post-test is wrong, okay? Only a few hours post-procedure in the recovery room. So we are not gonna do the 24-hour, what do you call this? Arterial pressure monitoring. So again, hang on a sec. Have arterial pressure monitoring. This is a continuous arterial pressure procedure that is not a standard. So not a standard, not required, I should say. So this is not required for a cardiac cath. Okay. What I was pertaining earlier was the monitoring by the nurse. Not really 24 hours, but again, the arterial pressure is not going to be required for this testing. Okay. Alrighty, let's move on to the next question. Almost done. Number 13, which post-cardiac cath with percutaneous coronary interventions, or known as the PCI task, can the nurse delegate to a licensed LVN or vocational nurse? Which task? Which post-cardiac cath with percutaneous coronary intervention task can the nurse delegate to a licensed practical nurse or a vocational nurse? Is it A, administer scheduled aspirin and lipid-lowering medication? B, perform initial assessment of the catheter insertion site? C, educate the patient about post-procedure care? And D, adjust the heparin infusion according to protocol. Okay, so this is a little bit more complex procedure because this is going to involve the PCI, percutaneous coronary intervention, on top of the cardiac cath. So this is going to be much more complex than the usual. Okay, so let me put in the answer here, guys. Answer is letter A, but we will talk first about what a percutaneous coronary intervention is. Okay, so what is this? This is another diagnostic test that can be done together with the cardiac catheterization. All right, so this will involve such as angioplasty. So this is one of the things that we are referring to as PCI. Another is stent placement. Okay, so this is much more of more complex procedure because it's going to do a lot more than just diagnostic. So it will do some angioplasty, or I mean the procedures that are associated with the PCI will be angioplasty and stent placement. And this is a procedure that will require, this is going to require, or the anticoagulation may be used. IV anticoagulation, such as heparin. Okay. And you know, right, that with IV infusions, medications that are given IV, this is mainly going to be appropriate for an RN. Okay. This is not going to be appropriate to delegate to a licensed practical nurse or vocational nurse. Nurses are supposed to be doing or administration of IV medication. And the reason that we are going to administer the IV anticoagulant, it is to prevent blood clot, post procedure, or during the procedure rather. And this is going to also reduce the thrombosis and other complications. So that's about PCI. Now let's go back into the option, administer scheduled aspirin. So we are actually delegating this task to the licensed practical nurse or LVN. So do you think it's appropriate? Yes, it is appropriate. That is a intervention that is within their scope of practice. Okay. So let me just do that. LVN, LPN, scope of practice. So we can do that, correct, for letter A. Now, what about letter B? Perform the initial assessment of the catheter insertion site. Well, that is incorrect. Okay, let me explain. Let me just erase this first. Okay. Yeehaw. Let me emphasize this, guys. Initial assessment should be done by the RN. Okay, please take note of that. Initial assessment should be done by an RN. So if you have like a new admission, a patient that just came into the hospital or the acute care or wherever, could be the LTAC or long-term care facility, it is appropriate for the nurse to do initial assessment. Do not let the LPN, LVN do the initial assessment, okay? Because looking into the different degrees or levels of assessment really require much more knowledge and skill, okay? I know that they can do assessment, but they don't have the same level of the skill compared to an RN can possess, okay? So make sure that you are not letting them do that. This is incorrect. What about letter C? Educate the patient about post-procedure care. That is also incorrect. Education is only appropriate to be conducted by the RN. Never delegate teaching, okay, by the LPN or LVN. It is always an RN's responsibility. That is within our scope of practice, never about LVN or LPN. Now, letter D, adjust the heparin infusion according to protocol. All the more. Titration or administration of IV meds is only within the scope of RN's practice. RN only. Okay? That is their main reason. Look back into the scope of practice between the LPN and RN. Again, go back into the initial assessment, education, administration of IV medication. What they can do will be administration of oral medication, subcutaneous And if it really requires much more complex assessment, then it would not be appropriate for an RN to deal with that patient. Okay, I'm talking about complex assessment, a lot of pathophysiological basis, then it will gonna be the RN only. Okay, do not delegate any of those very complex tasks. All right, now let's talk about number, yeah, very good. Number 14, which statement by the patient indicates a need for further teaching after a cardiac catheterization? Need for further teaching. Which statement by the patient indicates a need for further teaching after a cardiac cath? A, I should not bend, strain, or lift heavy objects for 1 day. B, if bleeding occurs, I should place on ice bag on the site for 10 minutes. C, I need to call the doctor if my temperature goes above 101 degrees Fahrenheit or 38.3 degrees centigrade. Or D, I should talk to the doctor to find out when I can go back to work. Again, A, I should not bend, strain, or lift heavy objects for 1 day. B, if bleeding occurs, I should place on ice bag on the site for 10 minutes. C, I need to call the doctor if my temperature goes above 10 or 101 degrees Fahrenheit or 38.3 degrees Celsius. Or D, I should talk to the doctor to find out when I can go back to work. Okay. All right, I'm seeing letter B's from AJ TV. How do you say your name? Joyce, Roberta, and Mary. Very good. The correct answer is letter B. And why? This is signifying that the patient did not really understand the teaching. They need to have reinforcement. Answer is letter B, requiring reinforcement. Okay, basically the patient did not really understand the post-procedure teaching. Okay, if they're saying that if they're starting to bleed, I should place an ice bag on the site for 10 minutes. Ooh, that is not how it's supposed to be done. Okay, well, this is an active bleed. And definitely will require direct pressure, not ice pack application. Okay, make sure that they apply direct pressure, not ice pack application, and make sure that they notify the doctor immediately. Notify MD immediately. All right, make sure they do that. Ice pack is not going to be sufficient. It will not cause the bleeding to stop. It will not be appropriate. So B is the option here. Okay, if you answered letter A, I should not bend, should not strain, or should not lift heavy objects for 1 day, this is going to prevent the complications at the insertion site, and this is going to be eliminated. Yeah. Letter C, I need to call the doctor if my temperature goes above 101 degrees Fahrenheit. Yeah, that is reflecting that the patient understood the teaching. They know how to deal with that kind of elevation of temperature. So we're eliminating that because it doesn't require further teaching. Now, letter D, I should talk to the doctor to find out when I can go back to work. That is also a good indicator that they understood the teaching. They need to consult the doctor first before they can go back to work. Okay, so we are going to select letter B. If bleeding occurs, I should place an ice bag on the site for 10 minutes. A patient basically did not understand the post-procedure teaching. All right. Okay. All righty. We are going to answer the last test question. Let's take a look. Question number 15. A 58-year-old woman with a history of hypertension and stable angina is scheduled for cardiac cath to assess her coronary circulation. She presents with occasional chest discomfort during exertion and has an antihypertensive medication for the past 5 years. Today, she arrives at the hospital to undergo the procedure to evaluate her heart's function and assess any potential blockages in her coronary arteries. Now, your task here, guys, is to identify whether each nursing action before sending the patient to the cath lab for cardiac catheterization is expected or not expected. Okay. I really want you to type in your answers here individually. We have shaving the insertion site and cleaning with an antiseptic solution. For number 2, withholding metformin for 24 hours before the procedure. And C, keeping the patient NPO for solid food for 1 hour before the procedure. Number 4, informing the client about potential sensations during the procedure. And lastly, apply sandbag to the left groin area. So I want you to answer individually here for each item. For number 1, number 2, number 3, number 4, and number 5. Okay, so type in your answers in the, good morning, Barad. So type in your answers in the chat box. Make sure that you indicate item, just put there 1, is it expected or not expected? Number 2, is it expected or not expected? So I want to take a look in your answers first. Okay. Your answers here should be, okay, I'm seeing CFAS answering 1, not expected, 2, expected. What about 3, 4, 5? Yeah, because this is an NG next gen type of test question. That's the matrix type. Okay. So Mary answered number 1, not expected, shaving the, not expected, are you sure? Not expected. Shaving the insertion site and cleaning with an antiseptic solution. And number 2, withholding metformin. Okay. Very beautiful. Answered 1, 2, 3 as expected. Okay. Mariama answered number 3, not expected. Okay. All right. I'll see AJI TV. 1. Okay. All right. You're creating your own rules here. B and A. Well, anyway, I will accept that as expected or not expected. Okay. Let's go through. Now, letter or item number 1. Okay. Shaving the insertion site and cleaning the site with antiseptic solution. Remember what I said earlier? As part of the care, it can vary from one institution to the next, but generally the shaving and the cleansing of the site will be expected. Why? This is going to reduce the risk of infection at the site, okay? So let me write down here. It is expected this will reduce infection. Of course, shaving the insertion site, okay? To be specific, guys, shaving will be done using the electric shaver. Okay. No straight razor. No straight razor. We don't want to cause any nicks or any small cuts. No, because this can be a site of infection later. So we don't want to have them use, or we're not going to use the straight razor. We're going to have to use the clippers, electric shaver. Now, what about letter or number 2? Withholding metformin for 24 hours before the procedure. Okay. Remember about the drug. The metformin can what? Metformin can what? Can do the complication. What it can do. Whoops. Metformin can cause the lactic acidosis. This is going to be held 24 hours post, or pre, rather. Whoa. Pre, before the test, or before the diagnostic test. Before cardiac catheterization. All right. So this is also expected. What about number 3? Keeping the patient NPO for solid food for 1 hour before the procedure. What did we talk earlier about the NPO? Remember that they need to be NPO for the solids. They need to be NPO for 6 to 8 hours for solid items, solid, and then 4 to 6 hours for liquids. Okay. Yeah, there is quite a range with the holding. In some institution, it will be 24 to 48 hours. So it's not really everyone is practicing the 48 hours. Yeah, you're correct, but it's not everyone. It's generally going to be 24 to 48 hours. Okay, thank you for your answer. Now, taking a look into the number 4, informing the client about potential sensations during the procedure. Remember about what I said about cautioning them on the expected sensation. So this is going to be an expected. Okay. Now, what about number 5? Apply sandbag to the left groin area. What about number 5? Did we answer expected or not expected? Okay. What did you answer about number 5? B. Remember that we are talking about before sending the patient. So this is pre-procedure. So there is no need for us to apply the sandbag. So this is going to be not expected. We are talking about pre-procedure nursing actions. Okay. So it looks like we have a question here. With antiseptic or soap water? Okay. To answer that question regarding the what do you call this? The preparation of the site before sending to the cath lab. Most often, this will be going to be an antiseptic solution, chlorhexidine. It doesn't mean that the preparation will end there. Once they arrive into the electrophysiology diagnostic room, they're going to have to do another set of cleansing or sterilization, or not sterilization rather, but disinfection of the site. They need to do another level of skin prep. Okay, the reason that we're going to do the shaving in the nursing unit and also the disinfection with the use of the topical solution, or it could be in a form of a liquid soap that has like that antibacterial ingredient. This is going to decrease the amount of the bacteria present in the skin. Okay, so this is basically that preliminary preparation. This is not the final preparation. Like I've said, once the patient arrives in the cath lab room, they're going to have to do another set of disinfection. They're going to have to apply another agent to make sure that the site is free from any microorganism. Okay. All right. All righty. So that actually ends our Q&A today. And again, please don't forget to check our website. We are offering the course there. And please check on the description box below. We have some more information regarding the course that we are offering. It's going to be accessible for 6 months upon your subscription. We do have our test questions, NGN test questions, more than 200 test questions, and 3,000 NCLEX questions, like the original forms, the multiple choice and stuff. There's also a big library of lectures there, animated videos, and so many things that you can access, such as our freebies. We got all those study guides as well that will help out in building your confidence. So let me just check real quick regarding the topic that we'll be doing tomorrow. So I believe that we will be talking about, we'll touch base on the heart failure tomorrow. So I'll be seeing you again at 9 p.m. Eastern time. We'll be talking about congestive heart failure, partly valvular heart disease, but I don't think I can finish off both. But because we're going to do a lot of NCLEX questions, and so I don't know if you're liking this a whole lot better compared to the theoretical input. And so, yeah, I'll see you again at 9 p.m. tomorrow Eastern time. I really thank you for your participation today. Let me know if you have any questions. Oh, before we'll end, I almost forgot. There was that question yesterday about this last item, number 19. It said something about an arteriogram. Patient feels nauseous, has tingling, and experiences shortness of breath. What should the nurse do immediately? Okay. Is it A, give epinephrine, B, notify the physician, C, administer oxygen, and D, reassure the patient the procedure is almost done? So going back into this question, I don't think I clearly presented the answer here. The correct answer here is to notify the physician. Why? So this is a diagnostic test. Of course, you're going to be the intervention radiology RN in this situation. And of course, the medical provider will be inside the room as well, doing this procedure with the patient. So if a patient is developing the nausea, tingling sensation, and they are reporting shortness of breath, okay? So I want you to think about this question objectively, okay? Make sure that you're understanding this objectively. Shortness of breath. It didn't say anything about anything else. Shortness of breath, it could mean anything. Tingling sensation, nausea, it could be caused by a whole variety of things. But when the patient states these manifestations, you have to notify the physician right away while you and the doctor is in the diagnostic room. Okay. The reason that you're gonna do the notification first before you're gonna give epinephrine or administer oxygen or reassuring the patient, because this is actually wrong, but why notify or why tell the doctor first things first? The reason for that, it's because when the patient goes in an arteriogram, this is basically gonna possibly will lead to an adverse reaction. Okay. They might develop an adverse reaction regarding the contrast media. Okay. So adverse reaction, allergic reaction. Okay. And could really require immediate intervention. And these manifestations are quite vague. It doesn't really would immediately tell us, hey, my patient is having allergic reaction. Everything is kind of like generic. We don't know for sure if this is really anaphylactic reaction or adverse reaction. So the most important thing here is to make sure you tell the doctor right away, because they will have that definitive decision what to exactly do next. Okay. So we can receive at least the appropriate medical intervention before we do so many things. Okay. So make sure that you tell them first. Okay. In order that the treatment will be done accordingly. Now, once possibly that the medical provider has established, hey, this is an allergic reaction, this is an anaphylactic reaction, we're going to do this. So possibly once you do that, then maybe he will order the administration of epinephrine, IV stat, or the administration of oxygen. Okay. Shortness of breath. It doesn't really mean that the patient has a complicated shortness of breath. It did not say anything about O2 saturation, hypoxemia. They're short of breath, but it didn't say that they're lacking O2, right? So this will call for some more assessment. We just don't automatically administer oxygen without assessing first. That is why this is incorrect. And that is why letter A is also incorrect. This will require a medical provider's order, and this will be dependent into the medical provider's decision. Hey, this is really an anaphylactic reaction. Give the epinephrine now. Okay. So we want to make sure that we are letting them know first. Okay. They will have a better idea what this is. All right. So I hope that clears things about the last portion that we had yesterday. And again, thank you for your attendance, and I will see you again tomorrow at 9 p.m. Eastern time. Thank you. Have a great day, and you take care, guys. Bye-bye.